Hello, nursing students. Today we are covering Chapter 10 for Anatomy. It starts, this is actually partway through it, so I think this is part 2, and it's on page 173. Spinal nerves. Life lesson, spinal cord injury. Over 10,000 people in the United States suffer from spinal cord injuries each year. Males between the ages of 16 and 30 have the greatest risk, mainly because of their tendency for high-risk behaviors. Most injuries result from car and motorcycle accidents. If the spinal cord is severed, often because of a vertebral fracture, it causes a loss of movement and sensation below the level of the injury. For example, a spinal cord injury between the levels of T1 and L1 causes paralysis in the legs, paraplegia. An injury above C5 vertebrae causes paralysis in all the limbs, quadriplegia. An injury above C4 is especially serious because this is where the phrenic nerve exits the spinal cord. Because the phrenic nerve innervates the diaphragm, an injury here can cause respiratory failure. Spinal nerves, part of the peripheral nervous system, relay information from the spinal cord to the rest of the body. A nerve consists of many nerve fibers, axons, encased by connective tissue. The number of nerve fibers contained in a single nerve varies from a few to as many as 1,000,000. Remember, a neuron is a nerve cell. A nerve contains many neurons. Nerve fibers are gathered together in bundles called fascicles. In turn, several fascicles are grouped together along with blood vessels and wrapped in a dense connective tissue. Most nerves contain both sensory and motor fibers and are called mixed nerves. These nerves can transmit signals in 2 directions. A few nerves, such as the optic nerves, are sensory nerves and contain only sensory or afferent fibers. They carry sensations toward the spinal cord. Others are motor nerves and contain only motor or efferent fibers and carry messages to muscles and glands. That makes sense. To make sense of the terms used for nerves and nerve tracts, think about this. Sensation always travels toward the CNS. Sensory nerves transmit impulses toward the spinal cord. Once there, they travel up the spinal cord, ascend along the ascending tract. As a further hint, remember that afferent or sensory nerves link to an ascending tract. Motor nerves carry messages about movement. Therefore, those impulses leave or exit the spinal cord along efferent or efferent motor nerves. Page 174, categories of spinal nerves. 31 pairs of spinal nerves connect to the spinal cord. They include 8 cervical nerves, C1 through C8, 12 thoracic nerves, T1 to T12, 5 lumbar nerves, L1 to L5, 5 sacral nerves, S1 to S5, and 1 coccygeal nerve, CO. The first cervical nerve exits the spinal cord between the skull and the axis. The other nerves pass through holes in the vertebra, intervertebral foraminea, which would be holes within those vertebral bones. Once outside the spinal column, each spinal nerve forms several large branches. Some of these branches subdivide further to form nerve networks called plexuses. The four major plexuses are the cervical plexus, the brachial plexus, the lumbar plexus, and the sacral plexus. The cervical plexus contains nerves that supply the muscles and skin of the neck, tops of the shoulders, and part of the head. The phrenic nerve, which stimulates the diaphragm for breathing, is located here. The brachial plexus innervates the lower part of the shoulder and the arm. Key nerves traveling into the arm from this region include the axillary nerve, which passes close to the armpit, making it susceptible to damage from the use of crutches, the radial nerve, the ulnar nerve, and the median nerve. The lumbar plexus, derived from the fibers of the first four lumbar vertebrae, supplies the thigh and leg. A key nerve in this region is the large femoral nerve. The sacral plexus is formed from fibers from nerves L4, L5, and S1 through S4. Because of the commingling of fibers of the sacral plexus with those of the lumbar plexus, these two plexuses are often referred to as the lumbosacral plexus. The sciatic nerve, the largest nerve in the body, arises here and runs down the back of the thigh. Irritation of this nerve causes severe pain down the back of the leg, a condition called sciatica. Dermatomes. Each spinal nerve, except for C1, innervates a specific area of the skin. These areas are called dermatomes. Clinicians use this information to identify the location of a nerve abnormality by testing a patient's response to pinpricks in the different areas. The body at work. Your ability to stand, walk, and correct your balance can all be attributed to reflexes. Specifically, skeletal muscles contain sensory receptors that send messages to the brain about the amount of stretch in a muscle as well as the movement of body parts. This allows the brain to emit signals to correct muscle tone and control movement. It also allows it to trigger a reflex to correct posture. For example, keeping your balance can be attributed to the reflexive contracting and relaxing of various muscles, all without your awareness. Somatic reflexes. Reflexes are a quick, involuntary, predictable response to a stimulus. Reflexes employ a neural circuit called a reflex arc, which bypasses regions of the brain where conscious decisions are made. That's why someone becomes aware of a reflex only after it's occurred. Some reflexes, called autonomic or visceral reflexes, involve secretion from glands or the contraction of a smooth muscle, such as the dilation of a pupil. These reflexes are governed by autonomic neurons, which will be discussed later in this chapter. Somatic reflexes involve the contraction of a skeletal muscle after being stimulated by a somatic motor neuron. Somatic reflexes often help protect the body against harm, such as causing you to withdraw your hand from a hot stove. Other reflexes help you maintain your posture. See the body at work on this page. Several reflexes, such as the patellar reflex, described below are commonly tested during physical exams to identify certain diseases. Let's take a look at this animation.
Reflexes are a quick, involuntary, predictable response to a stimulus. Reflexes use a neural circuit called a reflex arc, which bypasses regions of the brain where conscious decisions are made. Somatic reflexes involve the contraction of a skeletal muscle after being stimulated by a somatic motor neuron. Patellar reflex is a somatic reflex commonly tested during physical examinations to identify certain diseases. Somatic receptors, located in the skin, a muscle, or a tendon, detect a sensation such as the stretching of the thigh muscle when the patellar tendon is tapped. Afferent, sensory, nerve fibers send a signal directly to the spinal cord. The impulse immediately passes to a motor neuron. It bypasses regions of the brain where conscious decisions are made. The motor neuron initiates an impulse back to the muscle, causing it to contract, producing a slight kick in the lower leg.
Question. Bundles of axons within the white matter that serve as routes of communication to and from the brain are called A. Ganglions, B. Fascicles, C. Tracts, D. Plexuses. And the answer is C. Tracts. Rationale. Ganglions are cell bodies of the dorsal neurons clustered in a knot-like structure. Fascicles are bundles of nerve fibers contained within a nerve. Plexuses are nerve networks outside the spinal cord. The brain and cranial nerves. This is page 176. The brain is the site for thought, learning, reasoning, memory, and creativity. Indeed, the brain performs numerous amazing functions, many of which remain beyond our grasp. General structures of the brain. The brain is divided into four major regions: the cerebrum, the diencephalon, the cerebellum, and the brainstem. The cerebrum is the largest portion of the brain. Its surface is marked by thick ridges called gyri, singular is gyrus. Shallow grooves called sulci, singular is sulcus, divide the gyri. Deep sulci are called fissures. The diencephalon sits between the cerebrum and the midbrain. The cerebellum is the second largest region of the brain. Although smaller than the cerebrum, it contains more neurons than the rest of the brain combined. The brainstem makes up the rest of the brain. It consists of three structures: the midbrain, the pons, and the medulla oblongata. A deep groove called a longitudinal fissure divides the cerebrum into right and left cerebral hemispheres. A thick bundle of nerves called the corpus callosum runs along the bottom of the fissure and serves to connect the two hemispheres. The body at work. Because the brain's gray matter, the part charged with thought, learning, and reasoning, is located at its surface, the folds allow more gray matter to be packed into a small area of the skull. As an analogy, think of fitting a large piece of paper into a small space. It becomes possible if you crunch it into a ball. Scientists have long thought that the brain's folds explain why humans are more intelligent than species with smoother brains. Recent discoveries have revealed that the folding pattern varies with each individual, making a person's brain folds as unique as his fingerprints. What's more, scientists have discovered abnormal folding patterns in those suffering from a variety of mental and neurodevelopment disorders ranging from depression to autism. Gray and white matter. Like the spinal cord, the brain contains both gray and white matter. Unlike the spinal cord, in which gray matter forms the interior, in the brain, gray matter forms the surface. Specifically, gray matter, consisting of cell bodies and interneurons, covers the cerebrum and cerebellum in a layer called the cortex. Underneath the cortex is white matter. Although gray matter exists in patches called nuclei throughout the white matter. The white matter contains bundles of axons that connect one part of the brain to another. Meninges of the brain. Like the spinal cord, meninges covers the outside surface of the brain, offering protection. Nearby bone also helps protect the brain from trauma. The bones of the skull provide the outermost protection. In some locations, the dura mater separates to create spaces called dural sinuses. These sinuses collect blood that is passed through the brain and is on its way back to the heart. A subarachnoid space separates the arachnoid mater from the pia mater. In some places, the dura mater extends inward and separates major portions of the brain. The falx cerebri, shown here, well, not here, well, yeah, there it is at the bottom of the picture there, dips into the longitudinal fissure to separate the right and left hemispheres. Elsewhere, the tentorium cerebella extends over the top of the cerebellum, separating it from the cerebrum. Inside the skull, 3 layers of meninges cover the brain. The layers are the same as in the spinal cord. The dura mater consists of 2 layers. The outer layer, the periosteal layer, is attached to the inner surface of the skull. The inner meningeal layer forms the outer covering of the brain and continues as the dura mater of the spinal cord. The arachnoid mater is the middle layer. The pia mater clings tightly to the surface of the brain. Fast fact: men have larger brains than women. However, brain size is proportional to body size and does not reflect intelligence. Life lesson: meningitis. Infection or inflammation of the meninges is called meningitis. Infection may be caused by several different bacteria or viruses that gain entry to the central nervous system by spreading from other locations in the body, such as from an ear or sinus infection. Bacterial meningitis occurs less frequently than viral meningitis, but it can be life-threatening without immediate treatment. Symptoms of meningitis include fever, stiff neck, irritability, headache, drowsiness, and seizures. Infants with meningitis may have different symptoms, including poor feeding, bulging fontanelles, and a high-pitched cry. Viral meningitis usually causes milder symptoms, such as those similar to a cold or the flu. In fact, Viral meningitis often goes undiagnosed because the symptoms are so mild. To diagnose meningitis, a sample of the cerebrospinal fluid is obtained through a lumbar puncture. The fluid is then examined for bacteria and white blood cells, a sign of inflammation. Viral meningitis usually resolves on its own in 7 to 10 days, while bacterial meningitis requires hospitalization and treatment with intravenous antibiotics. Page 178. Ventricles. The brain contains 4 chambers called ventricles. 2 lateral ventricles arch through the cerebral hemispheres, one in the right hemisphere and one in the left. Each of the lateral ventricles connects to a third ventricle. A canal then leads to the fourth ventricle. This space narrows to form the central canal, which extends through the spinal cord. Cerebral spinal fluid. A clear, colorless fluid called cerebrospinal fluid, CSF, fills the ventricles and central canal. It also bathes the outside of the brain and spinal cord. CSF is formed from blood by the choroid plexus, a network of blood vessels lining the floor or wall of each ventricle. The body at work. The brain produces about 500 milliliters of CSF each day. However, much of that is reabsorbed. At any one time, an adult brain contains about 140 milliliters of CSF. CSF is not stagnant, rather, it constantly flows through the central nervous system, providing nourishment in the form of glucose and protein, and helping to remove metabolic wastes. CSF plays other roles as well. For example, CSF helps protect the brain against minor trauma. When the head is jolted, CSF acts as a cushion to keep the brain from striking the inside of the skull. In addition, CSF plays a role in the maintenance of homeostasis. Specifically, the brain monitors the level of carbon dioxide in the CSF and triggers responses as needed to help the body regain equilibrium. Let's take a look at this animation.
A clear colorless fluid called cerebrospinal fluid, CSF, fills 4 chambers in the brain called ventricles. Spinal fluid, CSF, fills 4 chambers in the brain called ventricles. It also fills the central canal of the spinal cord and bathes the surface of the brain and spinal cord. CSF primarily results as the choroid plexus, which is a network of blood vessels lining the floor or wall of each ventricle, separates fluid from blood. The choroid plexus in each lateral ventricle secretes CSF. The CSF flows into the third ventricle, where the choroid plexus adds more fluid. Then CSF flows into the fourth ventricle, where still more CSF is added. Some of the CSF flows through 2 tiny openings called foramina. From there, the CSF flows through the subarachnoid space, up the back of the brain, down the spinal cord, and up the front of the brain. The CSF is reabsorbed into the venous bloodstream by projections of the arachnoid mater into the dural sinuses, called arachnoid villi.
Which statement about gray matter is true? A, it is charged with thought, learning, and reasoning. B, it forms the interior of the brain. C, it consists of myelinated fibers. D, it secretes cerebrospinal fluid? The answer is A. The rationale is that gray matter covers the surface of the brain and it consists of unmyelinated fibers, and the choroid plexus secretes cerebral spinal fluid. So we know that gray matter is charged with thought, learning, and reasoning. Fast fact: although the brain constitutes only 2% of an adult's body weight, it receives 15% of the blood and consumes 20% of the body's oxygen and glucose. Life lesson: hydrocephalus. If the flow of CSF becomes blocked anywhere on its route, the fluid accumulates in the brain's ventricles. This condition is called hydrocephalus, or more commonly, water on the brain. The accumulating CSF causes the ventricles to expand. In an infant whose cranial bones haven't fused, the entire head expands. As an adult, however, has no such release valve. In this situation, the expanding ventricles compress the brain tissue against the sides of the skull and intracranial pressure rises. Untreated, the condition can prove fatal. It can, however, be successfully treated by inserting a tube or shunt to drain fluid from the ventricles into a vein in the neck. Formation and flow of CSF. And that was what we saw in the animation. So I'm going to move on to the blood-brain barrier. The brain demands a high volume of blood to function properly. However, blood also contains substances such as antibodies and macrophages that would harm the brain. As a means of protection, a blood-brain barrier serves to restrict what substances can pass from the bloodstream into the tissue of the brain. Tissue fluid of the brain. This barrier consists mainly of capillaries formed by tightly joined endothelial cells as opposed to the loosely overlapping cells that form the capillaries in general circulation. A thick basement membrane adds to the barrier, as do the feet of astrocytes, which reach out and surround the endothelial cells. This arrangement creates a semi-permeable membrane throughout the brain. As discussed previously, the membrane allows molecules like oxygen, carbon dioxide, and water to diffuse across to the brain, but blocks larger molecules. Other substances that can diffuse across the barrier include alcohol, nicotine, caffeine, and anesthetics. Trauma or inflammation can damage the blood-brain barrier and allow pathogens to enter. Fast fact: the circulation of CSF is aided by pulsations in the choroid plexus and by the motion of the cilia in the ependymal cells. Fast fact: an interruption in the flow of blood to the brain for as little as 10 seconds causes unconsciousness. An interruption for 4 minutes produces irreparable brain damage. Divisions of the brain. I'm on page 180. The divisions of the brain starting at the bottom are the brainstem, cerebellum, diencephalon, and cerebrum. Brainstem. The brainstem consists of the midbrain, pons, and medulla oblongata. The midbrain contains tracts that relay sensory and motor impulses. It also contains centers for auditory and visual reflexes, as well as clusters of neurons integral to muscle control. The pons contains tracts that convey signals to and from different parts of the brain. Several cranial nerves arise from this area. They include cranial nerves 5, trigeminal, 6, abducens, 7, facial, and 8, vestibulocochlear. The cranial nerves will be discussed later in this chapter. The medulla oblongata attaches the brain to the spinal cord. Besides relaying sensory and motor signals between the brain and the spinal cord, the medulla contains nuclei that perform functions vital to human life. These include the cardiac center, which regulates heart rate, the vasomotor center, which controls blood vessel diameter, which in turn affects blood pressure, two respiratory centers, which regulate breathing. The medulla also houses reflex centers for coughing, sneezing, swallowing, and vomiting. Several cranial nerves, cranial nerve 9, the glossopharyngeal, 10, the vagus, 11, accessory, and 12, hypoglossal, either begin or end in the medulla. Fast fact: because the medulla contains centers that regulate heart rate, blood pressure, and breathing, an injury here, such as from a blow to the base of the skull, can prove fatal. Cerebellum. About the size of a fist, the cerebellum houses more neurons than the rest of the brain combined. Connected to the cerebral cortex by approximately 40 million neurons, the cerebellum receives and processes messages from all over the brain. Long known to play a key role in motor functions, recent discoveries show that the cerebellum assumes a powerful role in sensory, cognitive, and even emotional functions as well. In brief, the cerebellum joins forces with the cerebral cortex to monitor body movements and send messages crucial for balance, coordination, and posture. It stores the information necessary for muscle groups to work together to perform smooth, efficient, and coordinated movements. It evaluates sensory input such as touch, spatial perception, and sound. People with cerebellar dysfunction, such as from a tumor, hemorrhage, or trauma, have a spastic gait, poor balance, jerky movements, and tremors. They also tend to have poor impulse control and overreact emotionally. Diencephalon. The diencephalon is a region deep inside the brain consisting of several structures, with the chief ones being the thalamus and the hypothalamus. The thalamus, shaped like two eggs sitting side by side, the thalamus resides on top of the brainstem. It acts as a gateway for nearly every sensory impulse, including smell, sight, taste, pain, pressure, heat, cold, and touch, traveling to the cerebral cortex. The thalamus processes and filters these impulses, transmitting some but not all to the cerebral cortex. The thalamus plays other roles as well. For example, it relays messages regarding certain complex movements. It also is involved with memory and emotion. Hypothalamus. The hypothalamus' small size belies its crucial function. In fact, this tiny area of the brain extends its influence to nearly every organ of the body. The hypothalamus plays a key role in numerous functions. For example, it controls the autonomic nervous system, which is responsible for such vital functions as heart rate and blood pressure. It contains centers responsible for hunger, thirst, and temperature regulation. It controls the pituitary gland, often called the master gland because of its influence on most endocrine glands such as the thyroid, testes, ovaries, and adrenal glands. It's involved in multiple emotional responses, including fear, anger, pleasure, and aggression. The body at work. Scattered throughout the brainstem is a set of interconnected nuclei called the reticular formation. Fibers extend from there to many parts of the cerebrum, the cerebellum, and the spinal cord. One component of the reticular formation is the reticular activating system, RAS. Charged with maintaining a state of wakefulness and alertness, the RAS receives sensory input from the eyes and ears. After filtering out insignificant signals, such as routine noise, it sends impulses to the cerebral cortex so the mind remains conscious and alert. Drugs that depress the reticular activating system induce sleep. The reticular formation also has tracts extending into the spinal cord that are involved in posture and equilibrium. Other components of the reticular formation include the cardiac and vasomotor centers of the medulla oblongata, which are responsible for heart rate and blood pressure. The cardiac and respiratory centers are found in the A. pons, B. cerebellum, C. diencephalon, or D. the medulla oblongata. And the answer is D. the medulla oblongata. Rationale? Well, the pons can convey signals to and from other parts of the brain. The cerebellum monitors body movement, and the diencephalon houses the thalamus and the hypothalamus. Cerebrum, the largest and most obvious portion of the brain, is the cerebrum. Your ability to think, remember, feel, use judgment, and move can be credited to the cerebrum. Some of the more obvious sulci, or grooves, divide the cerebrum into 5 distinct lobes. Each lobe is named for the bones of the skull that lie directly over them. The frontal lobe. Central sulcus forms the posterior boundary, and it governs voluntary movements, memory, emotion, social judgment, decision-making, reasoning, and aggression. It is also the site for certain aspects of one's personality. The temporal lobe, separated from the parietal lobe by the lateral sulcus. It governs hearing, smell, learning, memory, emotional behavior, and visual recognition. The insula is hidden behind the lateral sulcus. It plays a role in many different functions, including perception, motor control, self-awareness, and cognitive functioning. The occipital lobe is concerned with analyzing and interpreting visual information. The parietal lobe, The central sulcus forms the anterior boundary, concerned with receiving and interpreting bodily sensations such as touch, temperature, pressure, and pain. It also governs proprioception, the awareness of one's body and body parts in space and in relation to each other. Fast fact: if the brain surface were flattened, it would measure about 465 square inches or 3,000 square centimeters, or about the size of an opened newspaper. Life lesson: brain lesions. The symptoms resulting from injuries to key areas of the brain have been a primary source of information about the role those areas play. Following are some examples of symptoms that may occur following trauma or stroke to specific brain regions. The parietal lobe lesion. Dysfunction in this part of the brain causes people to ignore objects on the opposite side of the body, even their own arm and leg. Patients may dress only half their body and even deny the opposite arm or leg belongs to them. Temporal lobe lesion. An injury here can impair the ability to identify familiar objects. Some may not even recognize their own face. In other instances, the person may lose the ability to differentiate between sounds, causing him to lose any appreciation of music. Frontal lobe lesion. A lesion or injury here can result in severe personality disorders and cause socially inappropriate behavior. Inside the cerebrum. The bulk of the cerebrum is white matter, which consists of bundles of myelinated nerve fibers called tracts. Tracts carry impulses from one part of the cerebrum to the other, or from the cerebrum to other parts of the brain or spinal cord. Most of the tracts that pass from one hemisphere to the other travel through a large bridge called the corpus callosum. This arrangement allows the brain's two hemispheres to communicate with each other. The surface of the cerebrum, called the cerebral cortex, consists of a thin layer of gray matter. Even though the layer is thin, gray matter actually makes up about 40% of the brain's mass. Masses of gray matter called basal nuclei, or sometimes basal ganglia, lie deep within the cerebrum. These structures play a role in the control of movement. Other tracts carry information back and forth between the brain and the spinal cord. These tracts are extensions of the ascending or sensory spinothalamic tracts and the descending or motor corticospinal tracts. Note how the tracts cross in the brainstem, with the right side of the brain sending impulses to the left side of the body and vice versa. The limbic system. Sometimes called the emotional brain, the limbic system is the seat of emotion and learning. It's formed by a complex set of structures that encircle the corpus callosum and thalamus. In brief, it links areas of the lower brainstem, which control automatic functions, with areas in the cerebral cortex associated with higher mental functions. Two key structures of the limbic system include the hippocampus and the amygdala. Feelings of anger, fear, sexual feelings, sorrow, and pleasure only result because of a functioning limbic system. However, To ensure that those feelings are expressed in socially acceptable ways, the other parts of the cerebral cortex must also be engaged. Limbic system activity without the moderating influence of other parts of the cerebrum leads to attacks of uncontrollable rage. Hippocampus, charged with converting short-term memory into long-term memory, making it crucial for memory and learning. The amygdala is two almond-shaped masses of neurons on either side of the thalamus, concerned with emotions such as anger, jealousy, and fear. It also stores and can recall emotions from past events. This explains why a current event can trigger emotions from a previous experience, such as feeling pleasure when viewing a picture of a favorite vacation spot, or crying in grief on the anniversary of a loved one's death. Page 184. Functions of the cerebral cortex. Even though the specific areas of the brain focus on certain functions, these areas are not absolute and can vary among individuals. They can also shift within an individual to compensate for an injury, a characteristic known as plasticity. Keep in mind that no area of the brain acts alone. Normal brain function requires multiple structures of the central nervous system to work together. Many of the brain's roles require the integration of both sensation and movement. Motor functions of the cerebral cortex. The primary somatic motor area is the precentral gyrus. Movement begins with the intention to move. Neurons in the motor association area determine which movements are required to perform a specific task. It then sends the appropriate signals to the precentral gyrus. In response, neurons in the precentral gyrus send the impulses through the motor tracts in the brainstem and spinal cord. The impulses travel to the skeletal muscles and movement occurs. Sensory functions of the cerebral cortex. Sensory nerve fibers transmit signals up the spinal cord to the thalamus, which forwards them to the postcentral gyrus. The postcentral gyrus is the primary somatic sensory area of the brain. It receives impulses of heat, cold, and touch from receptors all over the body. Because of decussation, the right postcentral gyrus receives signals from the left side of the body, and the left gyrus receives signals from the right. Adjacent to the postcentral gyrus is the somatic sensory association area. This area allows us to pinpoint the location of pain, identify a texture, and be aware of how our limbs are positioned. Body at work. The illustration shown, well, I don't think it's shown actually in this PowerPoint, but the illustration shown in the book, here called a homunculus, maps the parts of the cerebral cortex dedicated to specific regions of the body. The size of the body parts in the illustration reflects the amount of cortical tissue dedicated to sending signals to and processing information from those areas. For example, the hands perform many intricate movements, and can detect a variety of sensations. Therefore, they demand a large amount of brain tissue. In contrast, the back performs few movements and has limited sensitivity. Consequently, it commands a much smaller area of the cortex. Language. Each aspect of language, which includes the ability to read, write, speak, and understand, is handled by a different region of the cerebral cortex. Number 1, written words stimulate the primary visual cortex. 2, the angular gyrus translates the written words into a form that can be spoken. Number 3, Wernicke's area formulates the words into phrases that comply with learned grammatical rules. 4, Broca's area plans the muscle movements required of the larynx, tongue, cheeks, and lips to form the words. It then sends the appropriate impulses to the primary motor cortex. Number 5, the primary motor cortex sends impulses to the muscles necessary to pronounce the word. Body at work. Because Wernicke's area, located in the left temporal lobe, is responsible for language comprehension, patients suffering an injury to this part of the brain have difficulty comprehending what others are saying. They will also have difficulty forming their own sentences to the extent that they may make no sense. This condition is called Wernicke's aphasia. Because Broca's area, located in the left frontal lobe, controls the movements required for speech, those suffering an injury to this area will understand what's being said, but they'll find it difficult or even impossible to speak. This condition is called Broca's aphasia. Question. The limbic system is charged with A, emotion and learning, B, identifying the location of pain, C, planning muscle movements to form words, or D, determining muscle movements to perform a task. And the answer is A, emotion and learning. The somatic sensory association area allows us to pinpoint the location of pain, and Broca's area plans muscle movements to form words. Neurons in the motor association area determine the movements required to perform a task. Special senses. The primary senses of taste, smell, vision, and hearing are handled by specialized regions of the brain, as shown here. For more information on the senses, see Chapter 11, Sense Organs. So here we see the olfactory association area, which interprets the sense of smell. The auditory association area gives us the ability to recognize familiar sounds, including a person's voice or the name of a piece of music. The primary auditory complex is responsible for hearing. The primary visual cortex is responsible for sight. It governs the recognition of size, color, light, motion, and dimension. The visual association area interprets the information acquired through the primary visual cortex. This area allows us to recognize familiar objects. and the primary gustatory complex handles the interpretation and sensation of taste. Sleep. The body, as well as the brain, requires periods of sleep, even dreaming, to function optimally. However, scientists still have much to learn about both sleep and dreaming. What is known, however, is that sleep occurs in repetitive phases called stages. Stage 1, the characteristics of stage 1, this is a period of drowsiness. People will awaken easily from this stage when stimulated. Brain waves are active. For stage 2, this is a time of light sleep. Brain waves show occasional spikes in amplitude, a reflection of the interaction of the thalamus and cerebral cortex. Rapid eye movement sleep, REM. About 5 times a night, a sleeper will backtrack from stage 3 to stage 2, at which time REM sleep begins. In this stage, eyes move rapidly back and forth and dreaming occurs. This stage lasts from 10 minutes to an hour. Stage 3. This stage of moderate to deep sleep begins about 20 minutes after stage 1. Muscles relax, the heart rate slows, and blood pressure drops. Stage 4. This is called slow wave sleep, SWS, because of the rhythmic brain waves. The muscles are very relaxed and the sleeper will be difficult to awaken in stage 4. Memory. The ability to store and retrieve information is one of the brain's key functions. The cerebral cortex handles 2 types of memory: short-term memory, in which information is stored briefly and then forgotten, and long-term memory, in which information is stored for days or years. Many parts of the cerebral cortex participate in creating memory. Memory most likely results when repeated stimulation permanently changes the synapses of a specific circuit of neurons. Experts also know that the limbic system as a whole, and the hippocampus in particular, plays a role in memory. If the hippocampus is damaged, the ability to form new memories is impaired. In fact, the hippocampus is one of the first regions to suffer damage in Alzheimer's disease, although it can be damaged due to hypoxia, encephalitis, or temporal lobe epilepsy. Cerebral lateralization. While the 2 hemispheres of the brain may look identical, they handle different functions. In brief, the left hemisphere is the more analytical side. It focuses on language and the types of reasoning used in math and science. The right hemisphere is more concerned with creativity and spatial ability. In a normal brain, the 2 hemispheres communicate with each other via the corpus callosum, allowing for the smooth integration of information. While neither hemisphere is dominant, the left hemisphere is usually considered the categorical hemisphere. While neither hemisphere is dominant, the left hemisphere is considered the categorical hemisphere, although this varies somewhat with hand dominance. For example, the left hemisphere is dominant for speech in 95% of those who are right-handed, while the right hemisphere is dominant for speech in only 4% of right-handers. In contrast, among left-handers, the right hemisphere is dominant for speech in about 15%, the left hemisphere in 70%, and neither in 15%. The following illustration highlights some of the specializations of each hemisphere. Fast fact: cerebral lateralization or dominance seems to be stronger in men than in women. In fact, when the left hemisphere is damaged, men are 3 times as likely to suffer aphasia. Although the reason for this isn't completely clear, scientists speculate that women have more communication between their right and left hemispheres. So the left hemisphere controls the motor control of the right side of the body, language, analytical thought, logical, concrete, science, and math. And for the right hemisphere, motor control of the left side of the body, big picture, creativity, emotion, imagination, art, and music. Cranial nerves. The brain has 12 pairs of cranial nerves to relay messages to the rest of the body. While still part of the peripheral nervous system, these nerves, unlike the spinal nerves, arise directly from the brain. Each cranial nerve is identified by a name suggestive of its function, as well as a number. Designated by a Roman numeral, the nerves are numbered 1 to 12 according to their order, beginning in the anterior portion of the brain. Some cranial nerves contain only sensory fibers. Some contain primarily motor fibers, while others contain both. 1. The olfactory nerve. 1. Sensory. Governs sense of smell, terminates in olfactory bulbs in the cribriform plate just above the nasal cavity. Impairment results in an impaired sense of smell, which may be linked to a loss of taste. To test, ask the person to smell substances such as vanilla or coffee. Number 7, the facial nerve. 7 is a mixed nerve. Sensory portion concerned with taste. Motor portion controls facial expression and secretion of tears and saliva. Damage causes sagging facial muscle and a distorted sense of taste. To test, check sense of taste on anterior 2/3 of tongue. Test ability to smile, frown, whistle, and raise eyebrows. The vestibulocochlear nerve, 8, is a sensory nerve. It's concerned with hearing and balance. Damage results in deafness, dizziness, nausea, and a loss of balance. To test hearing, balance, and ability to walk a straight line. Vagus nerve. It's the longest and most widely distributed cranial nerve. It supplies organs in the head and neck, as well as those in the thoracic and abdominal cavities. It plays a key role in many heart, lung, digestive, and urinary functions. Damage causes hoarseness or loss of voice and impaired swallowing. Damage to both the vagus nerves can be fatal. So both vagus nerves can be fatal. Test. Perform same tests as those for cranial nerve 9. Number 2, the optic nerve is a sensory nerve. It's concerned with vision. It links the retina to the brain's visual cortex. Damage causes blindness in part or all of a visual field. To test, check visual acuity and peripheral vision. 3, 4, and 6. Oculomotor, trochlear, and abducens nerves. They're mainly motor nerves. They regulate voluntary movements of the eyelid and eyeball. Oculomotor also controls pupil constriction. Damage can cause a drooping eyelid, dilated pupil, oculomotor only, inability to move eye in some directions, and double vision. To test, inspect the size, shape, and reaction of pupils. Check eye movements and ability to follow moving object. Trigeminal nerve. 5. It's 2 sensory and 1 mixed branch. Sensory branches, ophthalmic and maxillary, sense touch, temperature, and pain on the eye, face, and teeth. Mixed branch, mandibular, controls chewing and detects sensations in the lower jaw. Ophthalmic branch triggers the corneal reflex, blinking in response to a light touch on the eyeball. Damage to the sensory branches causes loss of sensation in upper face. Damage to the mixed branch results in impaired chewing and loss of sensation in jaw. To test, lightly touch eyeball with cotton swab to check corneal reflex. Evaluate sense of touch, pain, and temperature with pin, as well as hot and cold objects. Evaluate ability to open mouth and move jaw side to side. 9. The glossopharyngeal nerve is a mixed nerve. Motor fibers govern tongue movements, swallowing, and gagging. Sensory fibers handle taste, touch, and temperature from the tongue, also concerned with regulation of blood pressure. Damage causes impaired swallowing, choking, and bitter or sour taste. To test the gag reflex, swallowing, and coughing. Check taste on posterior 1/3 of tongue. Number 12, hypoglossal nerve. It's mainly motor. It controls tongue movements. Damage causes impaired speech and swallowing. Deviation of tongue toward injured side. To test, check for tongue deviation when the tongue is protruded. 11, spinal accessory nerve. It's mainly motor. It controls movements in the head, neck, and shoulders. Damage impairs movement of the head, neck, and shoulders. And to test it, you check the ability to rotate head and shrug shoulders against resistance. So that's all for the cranial nerves, and that's on page 189. I am going to pause it here and resume the part 3. We'll start on page 190, and that will include, the rest of it is mostly the autonomic nervous system. So thank you for listening.